Hi, I'm Sophie, nurse practitioner at Turner Medical Arts. These short episodes are all about real women's health and my clinical experience and knowledge. This is a channel where I talk about all things hormones, perimenopause, sexual wellness, birth control, weight support, and everything explained simply without the confusion. Let's dive in. Hi, it's Sophie, nurse practitioner, and today I'm going to talk about heavy bleeding. So, I have a lot of patients that are in their 20s who are coming to me with concerning symptoms, and one of those is heavy bleeding. So, when I say heavy bleeding, that is anything that is concerning. Concerning things to me are when they have bleeding that lasts for more than 7 days, if they're having clotting, and these are clots that are about the size of a golf ball, that's very concerning. The other thing is if you are filling more than 6 pads within 24 hours. That to say, to me, those are red flags, but even things that aren't that concerning or that severe, even things that aren't that severe can be concerning as well. So, a few things to think about when you're having these symptoms is if there could be a potential infection. So, one of the tests that we do is screening for potential sexually transmitted infections. Other things that could be going on is an abnormality. So, that could be an abnormality in your thyroid. It could also be an abnormality in your clotting factors. So, something that I saw recently was a patient who has been having years and years of this really severe and heavy bleeding and has been having anemia from all of the blood loss. And so we ended up doing some labs to see if there was something going on with the way that her body was clotting, and it actually came back positive. Sometimes people have these underlying clotting disorders that can really present in your menstrual cycle. Other things that we can look for could be structural abnormalities. Sometimes there are growths. Oftentimes they're benign, which means they're not cancerous, but things like polyps are little growths that can happen, and those can cause some bleeding as well. So, to really evaluate the cause of heavy bleeding, it's super important to do thorough lab work to see if there's anything underlying, whether it's thyroid or whether it's a clotting disorder, or even looking for other things like PCOS. If there's been missed periods, no periods, then really heavy periods, those are all things that we should think about. Getting a really good exam, if you're above 21 years old, getting your first pap smear to see if there's any abnormalities there. And then, yeah, just really making sure that you're keeping a good log of your symptoms, seeing your healthcare provider practice. Unfortunately, although heavy bleeding and all of these symptoms can be so excruciating and debilitating, a lot of times they're really written off. A lot of my patients have been told that that's just your period, it'll get better, take some ibuprofen. And when that's not doing the trick, I really urge everyone to take it seriously and get it checked out.